or how to look approachable. It's, I guess, a bit of a unique situation with this volunteer program where we're expecting people to just come to you in your everyday life. So we want to make sure that you are presentable and also that people feel comfortable coming up to you. So one thing that we always mention with even other programs is smile. It can be a huge difference. Obviously not a creepy smile. Don't wear a forced one or something that looks really silly. But try and have something that's warm. Think of something that makes you happy, I guess, would be the best way to describe it. And the other thing that's actually really funny is I remember taking some sociology classes and hearing about Australians in particular, how confidence is not something we really push because it can be considered arrogant. So try and be confident, but with just be a little bit humble at the same time. Because sometimes if you look too confident, it can be very intimidating for someone. Consider your body language and what it's projecting. So your eyes, always make sure you're having eye contact the whole time. Don't look down, don't wander off because it looks like you just can't be bothered and that you're not interested in what they're saying, and that's not great. Also make sure that if you have any weird little twerks or what's it called, like awkward gestures, like I know that sometimes I play with my keys, some people tap even. It shows that you're disinterested. It might not be. You might not be disinterested, but it seems like that to someone else that doesn't know you very well. And you will most likely be interacting with more strangers than people that you know. So non-verbal communication. The other thing I wanted to mention as well is, like I mentioned before when we were playing knots, not every culture actually is acceptable of two people touching hands that are strangers. So don't feel, if it's something that you do that you just instantly shake someone's hand, try not to. It's not really something that everyone accepts, so it's probably best if they approach you with it and you're okay with it, then that's fine, otherwise try not to. Same with any kind of comfort. You are still a stranger to them, so you might give off the wrong message. And watch their verbal and non-verbal cues as well. If it looks like they're they're finished with you and they're slowly walking away, it's probably a good indicator you're done as well. I know that if you have been part of my host key program, when we interact with people just as they come out of Monash Connect, and you're telling them about host scheme and MSA and they wander off that one direction over there, and you're still talking thinking they're next to you, probably a good idea that maybe you're just not interesting to them at the moment. Avoid your phone, similar to this presentation, I guess. If you're looking at your phone, another reason for them to think that you're not really giving your full attention to them, and you need to look accessible. So even if they're lost and they see you in the hostie shirt and you're playing with your phone, it's probably an indicator for them to think, all right, they're busy, they don't want to help me. Attitude and approachability, so be positive. When you're in the t-shirt, like I mentioned just earlier, if you think that you've woken up on the wrong side of the bed or you've just had a really bad weekend or something of that sort, then don't wear your t-shirt that day because you're representing our program, and if you're going to be bitter and you're not going to be approachable, then it's probably not best for you to wear your hostess stuff that day. And it will affect other people. Knowledge. So hopefully after these 2 days, you'll feel confident with the information that you have. And when you are confident, then that means you'll be confident with that student. You won't be arming and ahhing, and you won't feel uncomfortable with answering their questions, and you'll probably look more open to people approaching you. And there most likely will be basic questions. Like I said before, this is a pilot, or Tammy mentioned that before as well. So we really don't know what questions you'll be getting this year, and we'll give you all the information you need. And if it turns out that you only need like a quarter of that, then we'll modify it for everyone else. Okay, so if people aren't approaching you, think about why. It might be that you're not looking very outgoing or approachable, and be true to yourself as well. So if you really think that you're not really having a good day, just don't do it. And take care. Make sure that you're always in a public space with people. We also say this with anyone that's dealing with a grievance. We just want to make sure that there's witnesses available to say, yes, you were with this person in this space and this happened. Because if they are feeling very vulnerable, there is a chance that they might say that you've done something as well, which isn't great because you're only trying to help. So try and be in a public space at all times. It's always important to speak calmly and in a soft tone. I have a problem of having verbal diarrhea, so I say a lot of things at once. It's probably not best in those situations, so I almost have to say to myself, all right, Steph, calm down, pace it out. Focus on one topic at a time. So if they're coming to you about a mental health first aid query, then it's probably not best for you to be probing, but it might be good for you to summarise. I've done mental health first aid training, and I know that they don't try and push you to do things too much to almost like be an investigator. Really for you, just to keep things going along, summarise what they've said, and if it looks like that's not what you said, then they'll correct you. And don't confuse them, because if they're already upset, it's not the best way to go. Be patient. If you do have somewhere to go, it might be best for you to just direct them straight to the counselling service. And as a post-year volunteer, you're not actually expected to do too much with mental health anyway, but that's just for you to know. Be supportive and keep upbeat. Now, like I mentioned before, you most likely will be completing or conducting some surveys throughout the semester. Like I said, it's probably going to be one time that we ask that from you. And if that's the case, we're expecting you to use the iPads that we have, and the survey won't take more than 2 to 3 minutes. I worked in market research for 3 years, and some people get really pissed off if it ends up being more than that 2 to 3 minutes. So I assure you, it's only 2 to 3 minutes. And with your knowledge and being approachable, hopefully this won't be too much of an issue or a task. We will have signage around, and we'll probably put you somewhere where there's high traffic, like campus centre or in front of the Menzies. Don't nag people or harass people. Again, that's if you're trying to get them to do a survey, it's probably not best for you to nag someone and they see that brand and think, oh no, they're just the nagging volunteers. Taking care of yourself. Now, this is a big deal. You guys have a component of mental health training that will be this afternoon. And it means that you'll be able to help people, but to an extent. And we know that we don't really know what you're going to be asked, but if you are asked something that makes you feel uncomfortable or you just want to talk to someone, you do have that option. There are so many services here at Monash. In your orange booklets, I've put all the grievance officers that are on campus. I've also given you the numbers of the Save the Community Unit, and also for the counselling service and what's available when it's past working hours. Also, I should mention that you should keep everything private. So if that person comes up to you and tells you their deepest, darkest secret, it is not your responsibility to then put that on a post on Facebook or tell your friends about it. Part of your role is to keep the trust, and I hope that you do that in this position. Now, we've got postgrad coming in, but, oh, you're here, brilliant. I didn't see you from the side of my eye. Yes, take it away. Guys, remember you can follow this on your slides booklet. Thank you. Sorry.